COVID shots are set to reemerge in the U.S. The COVID-19 vaccines are poised to become widely accessible once more across the United States, following a period of uncertainty regarding vaccine availability this fall. The initial federal vaccine policy had led to a patchwork of access across the country, with vaccines being offered in some areas but not others. This week, the Centers for Disease Control and Prevention, CDC, introduced new guidelines for COVID-19 vaccines, removing a blanket recommendation and instead allowing individuals to make their own decisions. This shift in policy enables vaccines to be administered in pharmacies and by states to people of all ages. Prior to this fall, the CDC universally advised the COVID vaccine for anyone 6 months or older. The new guidance, drafted by a panel of experts appointed by Health and Human Services Secretary Robert F. Kennedy, Jr., emphasizes the importance of individual consultation with healthcare providers before vaccination. This individual-based decision-making approach includes physicians, nurses, and pharmacists in the decision-making process. Jim O'Neill, acting CDC director and HHS deputy secretary, stated, "Informed consent is back." He explained that the previous blanket recommendation for perpetual COVID-19 boosters had hindered healthcare providers from discussing the risks and benefits of vaccination for individual patients or parents. This change aims to empower patients and parents to make informed choices. Kennedy, a longtime vaccine skeptic, took action in May by restricting COVID vaccines. He announced that the CDC would no longer recommend them to healthy children and pregnant women. The situation became more complex in August when the Food and Drug Administration approved updated COVID vaccines for adults aged 65 and older and those with medical conditions, increasing their risk of severe disease. This change triggered varying responses across states, with some requiring prescriptions and others discontinuing vaccine administration. The new CDC guidance is based on a recent recommendation by the Advisory Committee on Immunization Practices, ACIP, a panel of external experts advising the agency on vaccine usage. In September, ACIP considered requiring a prescription for the latest COVID vaccine, but ultimately decided against it. Their recommendation on individual-based decision-making highlights the greatest benefit of vaccination for individuals under 65, who are at increased risk of severe COVID-19 due to underlying medical conditions. Once the CDC adopts ACIP's recommendations, they become official federal guidance. This guidance determines the vaccines that pharmacies can administer in many states. Without these guidelines, access was restricted in some states. Now, with the CDC's approval, access issues should be resolved. The agency's official recommendation enables pharmacists to provide vaccines again and allows states to order COVID shots through the Vaccines for Children program, which offers federally purchased vaccines at no cost to low-income children and those without insurance. Approximately half of U.S. children are eligible for this program. Susan Cansagra, Chief Medical Officer of the Association of State and Territorial Health Officials, advises, for the average person interested in getting their COVID-19 vaccine, you can reach out to your provider, whether a pharmacist or a physician. This accessibility is particularly beneficial for parents of young children who may have faced challenges in obtaining vaccines in recent weeks. Brigid Groves, Vice President of Professional Affairs at the American Pharmacists Association, confirms that most pharmacies now have a portion of the COVID-19 vaccine in stock. Patients or caregivers can follow the familiar process for obtaining vaccines as in previous years. The CDC's new guidelines also mandate that health insurers cover the cost of the vaccine. This individual-based decision-making approach ensures immunization coverage through various payment mechanisms, including entitlement programs like Medicare, Medicaid, Children's Health Insurance Program, and the Vaccines for Children program, as well as insurance plans regulated by the Affordable Care Act. Many private insurers have already committed to maintaining coverage for this season's COVID vaccines. America's health insurance plans. An industry group representing major insurers stated on September 16th that health plans will continue to cover all ACIP-recommended immunizations, including updated COVID-19 and influenza vaccines, with no cost sharing for patients through the end of 2026.